the Patient-Centered Research Institute teamed up with Susie Becken to publish an article about her son, Chad, a 36-year-old man who presented in 2010 with symptoms such as lower back pain, fatigue, frequent bowel movements, and weight loss. He had visited his primary care physician twice and even made a trip to the urgent care before talking with his mother about his continuing health issues. Each time he visited the doctor, he was sent away saying he had sludge in his gallbladder or acknowledging his liver count was high but never explaining why. They even attributed his symptoms to work-related stress. His mother accompanied him to a new facility to see a brand new doctor. She examined Chad and listened closely as he described his symptoms. She immediately ordered a colonoscopy. This test confirmed Chad had stage 4 colorectal cancer that could not be removed because it had gotten so large it had penetrated his pelvic wall. After 15 months of grueling treatments and side effects, Chad lost his battle to cancer at age 37. This is just one example of how detrimental an incorrect diagnosis can be. I, as a future healthcare professional, want to ensure the original beliefs and practices of healthcare are instilled in future practitioners. This is something I definitely don't want to happen to me personally in my career, but also in my family. Today, I will reveal the faults in the common ideal that seeing more patients and doing more testing will make more money for the facility. I will promote the ideal that taking time to listen and learn about each patient and doing minimal testing will prevent further emergency and primary care visits, which therefore eliminates waste and excessive expenditures. Also, I will give examples of how to fix the problem, how to change the views of practitioners, and the way the healthcare system functions today to improve patient outcomes. So, first we will analyze how the majority of healthcare facilities function today. They believe seeing more patients and putting a Band-Aid, as most people call it, on their symptoms will benefit the facility's financial status. The NIH, or National Institutes of Health, ran a study in 1999 that revealed average visit lengths for general practitioners are between 5 and 8 minutes. This is proven to lead to the rise in malpractice cases. This is not a fault of the caregivers. They must conform to the tight schedule they're given, and their bonuses are associated with the number of visits and the procedures done while they're there. This is defined by the AAP, or American Academy of Pediatrics, as resource-based relative value scale, which is the entity in charge of assigning compensations. These factors prevent the physician from bonding, listening, and collaborating with the patient to correctly diagnose and develop a personal treatment plan. While these methods do make a profit in the moment for the facility, they cannot be sustained because of patient turnaround due to misdiagnosis or continuation of symptoms. So let's look at a more patient-centered vision of healthcare. It's proven, just from having personal relationships with anyone, after some time, they begin to open up and tell you more personal things. So why should it be any different with our patients? If you know more about your patients, you can make a better diagnosis, and if they're being honest about their behaviors and symptoms, you can personalize their treatment plan so that they will better stick to it and get better quicker. There are so many costs healthcare facilities absorb when patients have recurring issues. According to the CDC, or Center for Disease Control, in 2010, chronic conditions accounted for 86% of healthcare spending. That really doesn't make sense because chronic conditions should be inexpensive and easy to treat. So, how can we fix this? How can we shift the view away from money and back to the primary concern, promoting the health of people? There's a huge idea on the horizon, and that's what I'm promoting primarily. This healthcare reform promotes engaging patients in their own care and giving practitioners performance-based incentives. In 2016, a study from McGill University was done on strong patient engagement. It showed a 20% improvement in patient experience of care and saved the healthcare system $340,000 in just 1 year. This is because engaged patients are more likely to follow the physician's instructions and take care of their health when they get home, which in turn prevents them ending up back in a hospital. I also think continuing education classes as a reminder to current practitioners and educating future practitioners in graduate programs and internships will help rewire the system. I am one of those future practitioners, and I truly believe we can make the shift. Although financial stability of the healthcare facility is important, our number one job is to promote positive health outcomes. There are definitely faults in the idea that seeing as many patients a day as you possibly can is the most beneficial. The way to change this idea is allowing practitioners to truly know their patients and their symptoms to lead to proper diagnosis and lessen the recurring primary care and emergency care visits. We just need to educate more and more people to enable the shift to promote positive patient outcomes. Hippocrates once said, "Health is our most valuable possession," and as practitioners, it's our job to promote health. We are the advocates for the sick, and it's our responsibility to do everything in our power to help them get better. Thank you.